Hi, this is Dr. Craig Tuttle. Today's topic is Carpel Tunnel Syndrome, also referred to as CTS. And what happens is with Carpel Tunnel Syndrome, there's 8 bones in the wrist called carpal bones. And I used to be involved with kind of a gross subject, but dissection when I was in graduate school. And when we dissected cadavers, people that had donated their bodies to be studied for improvement in the scientific community, what happens is that when the wrist, when you look inside the wrist, there's 8 different segments called carpal bones. They look like 2 rows of 4 bones called carpal bones. They all look like macadamia nuts. And of course I relate everything to food anyway. But those 2 rows of 4 bones are held together by a thick band of soft tissue called a retinaculum. It's not important to know the names of the soft tissues, but know that they're held together by muscles and ligaments, those 8 bones. And nerves pass through those 8 bones, kind of like a car traveling through a tunnel. And when imagine if there was a big traffic jam and there was a lot of pressure and you couldn't travel through that tunnel properly or in a smooth fashion, there would be a lot of congestion. And that's what the wrist does. It gets congested because the muscles and ligaments tighten up, causing those 8 bones to not move smoothly against one another. And so that stresses and puts pressure on the nerves as they flow through that wrist. And eventually it can cause numbness and tingling in the hands, pain in the wrist. All kinds of conditions can occur from pressure on those nerves as they go through the wrist. Typically in the past we've either done surgery or treated the condition with chemicals, pain pills or muscle relaxers to help reduce the inflammatory reaction in the body, only to find out that at best it only temporarily masks the symptoms. And what we found that worked better in chiropractic was once we know the anatomy and what the 8 bones are functionally designed to do, we go and do some gentle adjustments or movement of the wrist to stretch and loosen up those muscles and ligaments, allowing the soft tissues to become pliable and the nerves to flow without that interference. So as a chiropractor, and having been in practice for 27 years, I've seen hundreds of cases of carpal tunnel syndrome where people were either scheduled for surgery or were living in chronic pain, and were by able to gently move the bones of the wrist and unlock the pressure off the wrist, and then people could go back doing their activities such as working at a computer or doing repetitive motions with their wrists and hands and not have chronic problems develop. And they found it necessary not to have surgery and able to get out of pain. So we encourage you, if you're living with pain or taking drugs and treating the symptoms of the problem, or possibly contemplating surgery, we encourage you to try a conservative approach first and see if that doesn't make all the difference in the world for you. We do that in our office free. If you go to our website, you can get a gift certificate going to yourseattlechiropractor.com and printing out a gift certificate there, or by calling our office at 206-467-8611. We'd be happy to check your wrist and see if there's any restrictions going on and show you what we find. So thank you for your time today. This is Dr. Craig Tuttle. Thank you.